important development in the history of public health around contact tracing was the case of Typhoid Mary. And Typhoid Mary was actually an asymptomatic carrier of typhoid. The intervention that was made was to effectively isolate Mary Mallon for very long periods of time in order to make sure that she didn't come into contact with other people and inadvertently give them the disease. Contact tracing basically traces and tracks down people who have been exposed to an individual who already has an infectious disease. It comes to be used during the 19th century for diseases that were known to be transmitted either through the air via droplet transmission or through direct contact with individuals. And it was particularly developed for smallpox. And the reason why that's the case is because there was actually an intervention for smallpox that prevented the disease, and that was vaccination. Vaccination was discovered in the late 18th century. Contact tracing was usually performed by local medical officers or health commissioners or members of their health department. They would visit the household and then they would isolate the patient either within their home or in an isolation hospital, a fever hospital. The basic mechanisms haven't changed very much. I would say there'll be developments in the later 20th century with electronic reporting. They would do it via computer, for example. So the actual reporting itself. And, in terms of managing the contacts, the latest development would be the use of mobile apps. This huge effort for contact tracing is absolutely crucial for public buy-in for the relaxation of social distancing measures and regulations. And I think in future pandemics, knowing how to build that confidence through testing, tracking and tracing is going to be very important.